In our ongoing conversation about the growing pressure to put more mental health workers on the front lines to handle crisis situations, we are now bringing back social worker Keith Adamson on what that would look like specifically when a weapon is involved. Welcome back to Your Morning, Keith.
Good morning, Anne-Marie. Thank you for having me back.
Well, yesterday you and I spoke about the options that are available for people if they are in a crisis situation or they are with someone who's in a mental health crisis situation. So specifically, what would a call look like if a weapon is involved and a mental health worker was the first responder instead of a police officer?
So, from a social work perspective, whether there's a weapon or not, de-escalation consists of giving the person in crisis your undivided attention, being non-judgmental, focusing on the person's feelings, listening, allowing for silence, giving the individual in crisis space and time. Crisis situations require that you develop rapport really quickly, and sometimes, ironically, that takes time and patience. And of course, you should talk like I'm talking now in a calm tone.
So would people in your field then, Keith, be comfortable becoming in this case, the first responders? Right now, when there's somebody in crisis, you call 911 and they either dispatch an ambulance to take you to ER or they dispatch a police team. So if a social work team then becomes the first line of response, what does that look like? Do you dress in different clothing? Do you bring more than one person? Like physically, what would that look like?
I think that's great. I love the fact that we're reimagining together what the future could look like. I would think that you would have, let's forget about the clothes for now, but let's think about more who might respond. So you may have a social worker or two social workers, or a social worker and a nurse, a social worker and an ambulance worker. There are different models right now that exist throughout North America who would respond first. And maybe in the cases where there's a weapon or where the de-escalation is proving to be more difficult, then the secondary responders can be the police. And once they arrive, they take direction from the mental health professional who has established a relationship with the person in crisis.
Keith, you mentioned there are different models working right now. In the city of Toronto, there's the Mobile Crisis Intervention Team. They are trained for mental health calls, and they will not respond right now if a weapon is involved. And often in cases of mental health crisis, there can be one involved, often in cases of self-harm. So first responding officers say it is not safe for the nurse to be present there. And you say that this is a big problem with the system. Why?
Well, I think that we need to be more client-centered. Right, we claim that the mental health team goes in as a secondary response to ensure the nurse's safety. The nurse is not in distress. The client is. What about the client's safety? And so, for me, that requires somewhat of a paradigm shift in the way that we think about some of these mental health crises.
It's also interesting to point out as well that when in a hospital situation, when you have a mental health crisis situation happening, either someone has weaponized or not, it is a team of nurses and doctors who handle that call. How does the system structure differently in that environment? If when it's not in a home and it is in an emergency ward, there's no police presence there.
There's no police presence there. And I think, as I said yesterday, social workers, nurses, doctors who work in group homes and, in homeless shelters, et cetera, use de-escalation strategies all the time to manage and build relationships with people who are in crisis.
Keith, I want to thank you so much again for coming back to continue on this conversation. Good to have your voice on this.
Thank you so much, Anne-Marie. Have a nice day.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.